Hello and welcome. Today we're diving deep into a rare but significant heart condition, Takayasu arteritis. Often referred to as pulseless disease, this inflammatory disorder can have profound effects on the aorta and its major branches. Join us as we explore its causes, symptoms, diagnosis, treatment, and more. The exact cause of Takayasu arteritis remains a mystery, but current understanding points towards an autoimmune response. This means the body's immune system mistakenly attacks healthy arteries, leading to inflammation and damage. Genetic predisposition and environmental factors are also suspected to play a role, though specific triggers haven't been definitively identified. Research continues to uncover the complex interplay of factors that contribute to the development of this disease. Takayasu arteritis is characterized by chronic inflammation of the aorta and its major branches. This inflammation causes the artery walls to thicken, weaken, and potentially narrow. The narrowing, known as stenosis, can reduce blood flow to vital organs and tissues. In some cases, the inflammation can lead to the formation of aneurysms, bulges in the artery wall, which pose a risk of rupture. This complex process can affect various parts of the body, depending on the arteries involved. Takayasu arteritis is considered a rare disease, affecting primarily young women between the ages of 10 and 40. While it occurs worldwide, it is more prevalent in Asian countries, particularly in India, Japan, Korea, and Southeast Asia. However, it can affect individuals of any ethnicity. The true incidence is difficult to determine due to diagnostic challenges and underreporting. The signs and symptoms of Takayasu arteritis can be varied and often subtle, making diagnosis challenging. Early symptoms may include fatigue, fever, night sweats, weight loss, and general malaise. As the disease progresses, more specific symptoms may develop depending on the affected arteries. These can include pain or weakness in the limbs, dizziness, vision changes, headaches, high blood pressure, and absent or weak pulses in the arms or legs. Chest pain or shortness of breath may also occur if the arteries supplying the heart are involved. Diagnosing Takayasu arteritis typically involves a combination of physical examination, medical history, and various diagnostic tests. Blood tests can help detect inflammation by measuring markers like erythrocyte sedimentation rate, ESR, and C-reactive protein and CRP. Imaging techniques, such as angiography, CT angiography, CTA, magnetic resonance angiography, MR, and PET scans, are crucial for visualizing the arteries and identifying areas of inflammation, narrowing, or aneurysms. A biopsy of an affected artery may be performed in some cases to confirm the diagnosis. While there isn't a universally accepted classification system, Takayasu arteritis can be categorized based on the location of the affected arteries. Some classifications describe the involvement of the aorta, its branches, and the pulmonary arteries. The most commonly used classification system, developed at the International Conference on Takayasu arteritis, categorizes the disease into 6 types based on angiographic findings and the arteries involved, helping to guide treatment strategies. The primary goals of treatment are to reduce inflammation, prevent further artery damage, and manage symptoms. Medications commonly used include corticosteroids, such as prednisone, to suppress the immune system. Other immunosuppressants, like methotrexate, azathioprine, or mycophenolate mofetil, may be used as steroid-sparing agents or when corticosteroids are ineffective. In some cases, biological therapies, such as TNF inhibitors in G infliximab or IL-6 inhibitors in G, tocilizumab, may be considered. In cases of severe artery narrowing or aneurysm, surgical interventions, such as angioplasty, stenting, or bypass surgery, may be necessary to restore blood flow. Regular monitoring and follow-up are essential to assess treatment effectiveness and detect any complications. Unfortunately, there's no known way to definitively prevent Takayasu arteritis, given the unknown etiology. However, early diagnosis and prompt treatment can help minimize damage and prevent complications. If you experience persistent symptoms such as unexplained fatigue, fever, or pain in your limbs, it's essential to consult a healthcare professional for evaluation. The prognosis of Takayasu arteritis can vary significantly depending on the extent of the disease, the organs affected, and the response to treatment. Early diagnosis and treatment can improve outcomes and prevent serious complications. However, some individuals may experience chronic symptoms or require ongoing medical management. Recent research is focused on identifying biomarkers for early diagnosis, developing more targeted therapies with fewer side effects, and understanding the genetic factors that contribute to the disease. Clinical trials are exploring the potential of new medications and treatment strategies to improve the long-term outcomes for individuals with Takayasu arteritis.